Whenever you're ready.
Okay, good afternoon. My name is Itza Mendoza, and my claim of fact speech will focus on the health reform in America. To begin with, I am sure we have all heard of the government shutdown that is currently in progress. The major reason why this is occurring is because the government cannot seem to come to an agreement on the implementation of the Affordable Care Act. The Affordable Care Act, more commonly referred to as Obamacare, was signed into law by President Obama on March 23, 2010. However, many are still unaware of how they will be impacted when the reform will take place on January 1st, 2014. Although several opponents of the reform claim that the middle class will be hurt by Obamacare, I believe that the Affordable Care Act will positively alter the cost of healthcare for the middle class. There are four main reasons why I believe this. First, Obamacare will decrease costs for the middle class through increased quality of healthcare. Second, Obamacare expands Medicaid. And third, it will prevent insurance companies from wasting your healthcare money. And fourth, tax credits and subsidies will be available for those with a middle income. Okay. To begin, Obamacare would decrease costs for the middle class through increased quality of healthcare. You might be wondering, well, what's wrong with the quality of healthcare? Don't doctors have to go through intensive schooling in order to be able to practice? This is true. However, our healthcare system is wasting money that could be used more wisely. In essence, our healthcare system is not giving its best because we are wasting money on unnecessary things. According to the Institute of Medicine, an unbiased and independent nonprofit organization that works outside the government to provide unbiased and expert opinion to decision makers and the public, the American medical system wastes an estimated of $750 billion a year while failing to deliver top-notch care. Out of those $750 billion, $210 billion was spent on unnecessary services, such as repeated tests, and $130 billion spent on inefficiently delivered systems, such as a scan performed in a hospital instead of being performed in an outpatient center where money would have been saved. Now, how does the Affordable Care Act eliminate these unnecessary costs to the middle class? Obamacare eliminates these unnecessary costs by increasing the quality of healthcare. In more simple terms, the middle class will pay less for healthcare because Obamacare ensures that Medicare payments depend on the quality of care they provide, not just the amount. Therefore, hospitals will forego unnecessary care and help patients recover faster. Obamacare will also increase the quality of healthcare by increasing free preventative care, such as free vaccines, screenings, and even education and counseling. That means that we won't have to pay for those flu shots, or that my grandmother can get a free mammography exam to make sure that she is in good health. Free preventative care does not only save money in that instant, but also saves money on the long term. How? By preventing diseases that could be more costly to cure or to treat. Second, Obamacare expands Medicaid, healthcare for the needy, which will benefit the middle class. According to the Kaiser Family Foundation, Obamacare expands Medicaid to adults with incomes at or below 138% of the federal poverty line, starting on January 1st, 2010. For a family of four, the eligible household income would be $31,322. This will create a new middle class that will be eligible to receive Medicaid. In more simpler terms, for those who are part of the middle class but were previously uninsured because their income was above the poverty level, now will be able to receive Medicaid. Again, the expansion of Medicaid will benefit the middle class by giving many of them access to Medicaid. Third, the Affordable Care Act will prevent insurance companies from wasting your healthcare money and prevent them from imposing unfair rules. If insurers spend too much money on expenses for their business operations, and not enough on your healthcare, you get a rebate. This is called the 80-20 rule. This rule states that companies must spend 80% of their funds on medical care. Also, lifetime dollar limits on care and annual limits are being phased out by 2014, which means that insurance companies no longer can impose those unfair rules where you have to have a dollar limit on your lifetime insurance. And according to the White House, 105 million people no longer have lifetime dollar limits on their coverage because of Obamacare. Fourth, tax credits and subsidies will be available for those with a middle income. Coverage will be available at a lower cost. For instance, if we take a family and their income, a family of four, and their income ranges from $23,550 to $94,240, they will be able to save money on their premiums. So in conclusion, I believe that Obamacare will actually aid those in the middle class by reducing health care for them. First of all, by increasing the quality of health care. Second, by expanding Medicaid. And third, preventing insurance companies from wasting their money and imposing unfair rules. And fourth, by implementing tax credits and subsidies, making tax credits and subsidies available for those in the middle class. Thank you.
All right, it's the topics identified pretty clearly. By the way, you might want to note that the shutdown is over, so we can celebrate tonight. You do clearly state your claim. And there's a very solid layout of what the secondary points are going to be. So organizationally, you're good at the opening part of the speech. In the body of the speech, you also did a good job signposting the supporting points as they came up. On the first point, I think that's where you actually had your best information concerning issues of wasted money. There's a source that's given, there's a quantification that's provided, piece of factual data that's going on. After that, mostly what you present are hypothetical examples based on the factual data about what the law requires without explaining how the law will actually be able to achieve those results. Some of this, of course, is necessary because it hasn't been fully implemented yet, and so we have to deal with the hypotheticals. But I think a lot of the criticisms of the law are based on those hypotheticals also. For instance, you say we won't have the lifetime limitation on coverage. That was like one of your last claims. That assumes, which is true, the rule is gone, but that means that that assumes that there's going to be continuing availability of funds, and one of the arguments that gets made is that the costs are unsustainable. In other words, we won't be able to have enough money to pay for this, and so if the whole program collapses, then the answer is nobody's going to have that particular care. So that'll be one of those issues that I'm sure will come up in the argument. Like I said, I think organizationally everything was pretty solid. Your evidence is a little bit less developed than it needs to be. Like I said, you've got a lot of factual data about what the law requires, but it's hard to estimate that any of that's going to work. We don't have any comparable examples that are being used to show that similar programs saved money in the past, or we don't have any authorities who talk about how this should address this particular issue. Like I said, we get pieces of factual data about what the law is going to require and what currently exists, but that's where the devil is. The devil is in the details on those particular points. I thought you did a pretty nice job speaking to us. Maybe you could do a little bit less reading, but it was all very clear and easy to follow. Thank you.